What's one of the most important parts of that consultation is a conversation about what your goals are. So when someone calls the Evewell looking to book a fertility review, it is usually that they're looking to explore their own fertility or as part of a couple. We offer a number of fertility reviews for couples, same-sex couples, and single people as well. And those fertility reviews will involve a combination of ovarian reserve assessments and semen analyses, depending on the makeup of that couple. When we're thinking about ovarian reserve assessments, there are two main elements to that. We would be doing an internal ultrasound scan, looking in particular at the ovaries and counting the number of follicles that we can see in those ovaries. So follicles aren't eggs, but they are fluid-filled sacs that have the potential to go on and release an egg in the middle of the cycle when you ovulate. By counting those follicles, we can get one indicator of somebody's fertility potential, and we combine that with a blood test called an AMH blood test, which stands for anti-Müllerian hormone. And that can give us an indication, combined with the follicle count, of somebody's full ovarian reserve and fertility potential. If we're thinking about semen analyses, we're looking at the count of the sperm, the shape of the sperm, and the way that sperm is moving. And if we're looking at a couple with eggs and sperm together, then that gives us an idea of that couple's fertility potential as a pair. If they've already been trying to conceive and have not been successful, it can give us some indications of where there may be hurdles that we need to help them overcome. We'd always combine investigations with a conversation with a fertility specialist, one of our doctors. And the purpose of that conversation is to interpret those results for you. That can be a complete minefield if you're trying to get those results on your own at home through a home testing kit without having somebody there to interpret those results. But what's one of the most important parts of that consultation is a conversation about what your goals are. So if somebody is looking to freeze their eggs, at that consultation, we're going to be talking about what your goals are. That might include how quickly you would be looking to try and start a family. Is it that you're looking to start a family in just a couple of years' time? Or is it that you're looking to start a family maybe in 5, 6, 7 years' time? Because that is going to play a part in whether we are suggesting that egg freezing is something that you should be considering doing. The other thing that we're looking at is how many children are you looking to have? Have you met the person that you're wanting to have a family with? In which case we might talk about creating embryos with that person, either with their sperm or with donor sperm, in order to be able to plan for that future family for you two together. Sometimes people do a combination of eggs and embryos. What the doctor will then be doing is looking at your clinical results and your goals for a family and helping you come up with a plan of what we may need to do to help you reach those goals or give you a better chance of reaching those goals in the future. So for example, somebody coming to us who's saying that they want to start a family in a few years' time and they want to have quite a large family, the doctor might be saying you may not need to use these eggs for that first child, but you might want to think about having eggs in the bank for babies 2, 3, and 4, if the chances are that you're going to be having those children slightly later in life. This can make it slightly easier for you to go on to have those children if you would be looking to have them maybe in your early 40s. By freezing your eggs earlier, late 20s, early 30s, you can then have a similar chance of success as you would do at that age, even later in life. There are several groups of people that might consider freezing their eggs. It might be that you are looking to delay parenthood further down the line, maybe for several years at a time. It might be that you are actually quite close to wanting to start a family, but you are wanting quite a big family and you're starting at a point where your second, third child might be slightly later in life, where it might be a little bit harder to conceive. So while there might not be any current fertility issues and that first child is relatively straightforward, you are preserving your fertility at this age for future pregnancies. Another group of people that might consider freezing their eggs is if they're going to undergo some form of treatment that may mean that their fertility is impacted. It might be that someone's trans and wanting to go through a medical transition. It might be that there is some other kind of clinical treatment that is needed that means that preserving their fertility at this point is a really good idea to try and preserve options for the future. We never like to say that egg freezing is an insurance policy or any kind of guarantee for the future, but we know that younger eggs have a better chance of going on to create a healthy pregnancy. And therefore, by freezing your eggs, you are preserving options for yourself in the future. If you were thinking about fertility preservation as a couple, we would be talking about your goals for the future and your family. Are we thinking about undergoing treatment because you are looking to have a child now? Is it that you are maybe wanting to delay for a few years and your results indicate that maybe we should give you some treatment to try and help preserve those options for the future? Or it might be that actually everything is absolutely normal on your results and there's no reason to think that you're not going to be able to conceive naturally. However, you may be coming to this slightly later in life and want quite a big family, in which case there may still be merit in freezing some embryos in order to preserve some options for your future and for babies number 2 and 3 potentially.